Thank you. Thank you, Acting President. My question is for the Minister for Higher Education. A recent survey by the Health and Community Services Union found 96% of the workforce had witnessed violence in their workplace. The workforce identifies a clear nexus between addiction and this violence. Allied health workers say they need more training and support. Many would like to be skilled by studying Dan Lubman's graduate certificate in addictive behaviours at Monash University, but cannot afford it. The government already offers 10 scholarships in the graduate certificate to general and mental health nurses. So my question is this. Would the Minister consider expanding the number of scholarships offered and include all allied health workers, such as occupational therapists and social workers? Just given the quick time, I spoke very quickly thinking I didn't have much time there. So this is around being able, these allied workers being able to do further study and receive a certificate for it, particularly to study that graduate certificate in addictive behaviours.
Thank you. Time to start question time. Oh, where was I?
That was the first one.
I thought, okay, who was the question to? Thank you, my apology. I had a lot of things to do anyway. Minister Dean.
Thank you, President, and I thank Ms Patten for her question. This is a matter that has not been raised with me before by anyone, so I'm happy to take more information on board with it, and also in terms of what has been past practice. As the member would appreciate, in terms of the funding of higher education, it's the primary responsibility of the Commonwealth, but I am happy to receive further information in respect to this, and in particular the efforts in relation to building that pipeline of skilled workers that are needed in terms of government priority areas.
Patten on a supplementary, my apology to you.
Thank you, President. No, and thank you, Minister, and I appreciate that, and we'll seek to contact your office about this to provide further information. And in many ways, you've actually probably answered my my supplementary, because I wanted to ask whether you would agree that it is actually urgent to upskill our allied health workforce, and this was one of the key recommendations of the Mental Health Royal Commission. So, yeah, I wonder if I could seek from you also further information about any other scholarships or any other opportunities that these workers may be able to avail themselves, appreciating that there's a federal responsibility, but there may be some state opportunities for them to avail themselves of.
Minister.
Thank you. I think one of the things that you might look at, and others in the House as well, is when I receive the statewide skills plan from the Victorian Skills Authority. Now that will be in April, and that will indicate current and future shortages in the workforces, and indeed alignment to those government priority areas. And of course, health and allied health has always been a priority, and particularly at the moment. And we had that in mind when we also constructed the membership of the Ministerial Advisory Group that has been appointed for the Victorian Skills Authority. And I have tasked the CEO to provide me, as a matter of priority, what needs to happen in terms of health and allied health workforce, as well as construction in terms of major projects. Thank you.
Time.